Ted Kemp is the managing editor for CNBC International Digital. He is based in Singapore, and he just made it into work. Ted, good evening Eastern time here. Good morning to you. How are things changing in Singapore on the streets and alleyways there?
Well, I would say that for the most part, life is carrying on more or less as usual. There are little differences to everything. We have some flexibility in the hours that people are working, for example. You're seeing public commute be a lot lighter than you would see normally. A lot more people wearing masks than usual. But for the most part, we're carrying on business as usual.
Has your family, are you with your family there, or have you told visitors to stay away, your family to stay home, or what?
Yeah, I have a 9-month-old son and my wife, and they're in St. Louis. We were in a position where they were scheduled to come back here, and I decided, we pushed it back once, and we decided to push it back again. So, because we could actually get to a point, we have to sort of think about this, where we could, if they were to come here, it might become difficult for them to get out if other countries were to impose a travel ban on Singapore. So we just decided to keep them in the States.
All right, Ted, good to see you, my friend. We'll be checking back with you in the days ahead. We appreciate it. Ted Kemp in Singapore. Dr. Gottlieb, I want to come back to you as Meg digests some of these numbers that we have just seen, and it certainly does appear that this big leap, 14,000 new cases in Hubei alone, a lot of them in the epicenter of the virus, Wuhan, were people who had started to present some symptoms, but maybe not been totally diagnosed yet, but now they are.
I think that that's right, based on what we're reading, and we're trying to translate from the Chinese text that was posted online tonight just moments ago. I would also turn your attention to comments from the CDC director here in the United States that were out just this evening, where there seems to be a shift in the tone of health officials here in the United States, where they're starting to put out messages that there's more of an expectation that we will have secondary spread here in the United States. There will be small outbreaks. Again, we can deal with that. We can try to contain them, and those strategies may work. But I think there's a growing expectation that we will have more cases in the United States, and they won't just be imported cases. There'll be cases that are the result of secondary spread, people coming into this country who are then transmitting the virus to other people who are already here. And leading to some small outbreaks.
So you say basically a couple of things as takeaways. I'm going to ask you to stick around as we go to Eunice Yoon in Beijing. One of the things is that you need to watch what's happening in Singapore and other places like that. Now let's go to Eunice Yoon in Beijing with some color and context on these latest numbers, which are quite alarming out of Hubei Province. Eunice.
Yeah, that's right, Tyler. The number looks very big. It's 14,840. And just to break it down a little bit, this includes confirmed cases in the way that the Chinese had previously defined it, as well as a new category, which is called clinically diagnosed cases. So in the past, they did not include this group of people. And the clinically diagnosed people are people who haven't yet been tested with a test kit, which is how the confirmed cases were categorized, but instead have been scanned with a CT scan. And so that's why the number is so large. And also another reason why we think the number is large, though we're still sifting through this, is that it looks as though it's including the clinically diagnosed cases for the past couple of days, maybe since February 8th. So that kind of explains why the number jumped so much today. Also, the dead, 242. So that is quite a big jump as well, Tyler.
Eunice, this is incredibly helpful context. Thank you. And is it understood that they might be using the CT scans because they don't have enough test kits to actually confirm people with the official tests?
Yeah, that's what we've been hearing a lot. In the past couple of days, there's been a lot of questions about how China was changing its methodology to break it down from just confirmed cases to confirmed cases, suspected cases, and then this new category in Hubei called clinically diagnosed cases. And so people were saying, oh, maybe the Chinese are trying to switch this around because they're trying to lower the numbers. And as we've been talking about for the past couple of days, we've seen those numbers drop. But when you look at what the National Health Commission has said, it looks as though the protocol and the way that they're revising it is trying to give more transparency to medical medical workers. So suddenly now we're seeing this big jump in numbers, and it looks as though the big jump is not because of the way they're categorizing these cases, but potentially because the problem potentially has been because they haven't had enough test kits, and that's been the main bottleneck. At least that's what we understand in the categorization of these cases.
Eunice, stay where you are as I bring back in Dr. Gottlieb. Dr. Gottlieb, you have a thought here?
Yeah, one quick comment. If they're confirming these cases based on CT scan, that would suggest that these patients are probably pretty sick, because the findings on CT scan that you would see consistent with coronavirus would be a lot of inflammation in the lungs, particularly in the lower airway. And so these patients probably are pretty sick, the ones that are being now scoped into those official numbers.
And Eunice, one quick follow-up on the number of deaths being so much more than we've seen. Do you get the sense that that is, as you indicated, for perhaps the jump in case numbers as well, a compilation over a few days? Of why would that death number rise so much, if you have any clue to that now?
Eunice, did you hear that question?
Oh, sorry. No, I didn't. I thought you were talking to Dr. Gottlieb.
Phrase it again.
Apologies, Eunice. I was just asking if there's any clue as to why the death number might have risen so much. Is it a compilation of numbers over a few days, or is there some other explanation?
That we don't know just yet. I mean, it could just be from today. I don't actually think it's a compilation of the past couple of days, because those probably the dead would have been counted earlier. So I think that to me was the most alarming number, that the dead had jumped so significantly from the previous day, especially in light of the fact that the authorities have been really showcasing the fact that the numbers of confirmed cases have been dropping to try to calm people and say that their prevention and control mechanisms have been quite successful.
One more question for you, Eunice, before I go. What are you sensing as you come to work in the morning? Are you sensing a different kind of response, a more intense response, different kinds of protective gear being worn by officials and so forth? What can you tell us about what you're seeing on the ground?
Well, again, what I think is interesting is that the commentary and the message that we're getting from the top has been that things are better. But then on the ground, coming in this morning, just to get out of my house, the security guards now at my residential compound are wearing hazmat suits. Yesterday, they were only wearing masks. And yesterday, they had asked for my residential ID. So they want to see my passport. They want to make sure that I live there, that I have a residential card. They want to look at my house key to make sure that I'm actually a resident in that place, and that it wasn't as rigorous as the previous days. So actually what you're seeing on the ground is the restrictions getting tighter, at least here in Beijing, possibly because there are a lot of migrant workers who end up coming to Beijing after the Lunar New Year holiday. But it's definitely not in line with what we are hearing from the Beijing leadership.